I'm Dr. Sarah Petrich, and I am wondering if you really can breathe through your nose adequately, because it's really important. And if you want to know why, we have another video on that. But first, I have a few questions for you. Can you breathe with your mouth closed through your nose for 1 minute comfortably? Do you ever wake up in the morning with your mouth open, dry mouth? I hate to say it, but sometimes drooling. Ugh. You're breathing through your mouth when you sleep. Can you even close your mouth comfortably? Because some people actually can't without creating tension. So when you close your mouth, some people, because of their occlusion or some other factors, really can't do that comfortably. If not, you are probably still a mouth breather. And then, can you breathe through both nostrils, but not at the same time? Can you breathe through each one? So you can do a simple sniff test, close one nostril and breathe in. And then try the other one. And if you're like, oh, I can't breathe through them the same amount, that's okay, don't panic, that's normal. We have a circadian rhythm that switches your dominant nostril. Yes, you have a dominant nostril, but it'll switch ever so often. So it's okay if one is more open than the other, but you still want to be able to breathe through both nostrils. Now, if you're like, hey, I've got a cold, no problem, that's temporary. You know how to take care of that. But some people have chronic allergies all the time, and that impacts your ability to breathe through your nose. This is an issue. So if you haven't already tried over-the-counter help, which may sound obvious, but you'd never know, try to do something for your allergies. If that's not enough, go talk to an allergist. Your ability to breathe through your nose is so important to your quality of life. If you appreciate how important sleep is for the quality of your life, then you should value whether you can breathe through your nose. Now, you might also have difficulties breathing through your nose because of inflammation. And there's some disorders. One that's more common is called rhinitis, and that's an inflammatory issue of your nose, and you can get help from a doctor for that. So if that's an issue, you should definitely look into that. Now, there are some other factors that can impact your ability to breathe through your nose. You can have some anatomical abnormalities, and that can be created because you had some trauma. So some facial trauma, or you had surgery. If you've had your nose done, that might be an issue for you. There also can be just regular anatomical abnormalities that happen, like deviated symptoms. Some people have really high palates, so that's the roof of your mouth. And if it's high and narrow, that also will impact your upper airway. You may want to talk to an airway-focused dentist, and that's the big key. They need to be kind of more airway-focused and understand airflow. People or dentists that specialize in sleep disorders are usually good references for that. You also might need to talk to an airway-focused ENT. That's an ears, nose, and throat doctor, because you might have issues in your nose like turbinates and adenoids. I won't go into the details of those, but if you have some of those issues, you may need to have that checked out. And people who really struggle with that, if they do an appropriate intervention to help with that, it can greatly impact your life. And then there's one other issue, and that goes back to a dental issue as well. There was the high palate issue for the mouth, but also if your teeth don't line up nicely and you've got some malocclusions, that's the fancy term for it, but your bottom teeth and your top teeth don't line up well, and your jaw doesn't line up with your mandible, that's the top of your mouth, you also might have some airway issues that are impacting your nose. Now, that being said, those are all like go to the doctor kind of things. However, there's also some really simple things you can do to make your life better and make it easier to breathe through your nose. If you just don't breathe through your nose when you're sleeping, nasal strips are the simplest thing you can do and cheap. So there's all sorts of different kinds, but there's ones over your nose. There's even some that go on your face and just pull the skin apart and open up your airflow. Now, there's also people that just have a habit of breathing through their mouth. And if you just have a habit of breathing through your mouth, you can even just tape your mouth shut. Sounds extreme, kind of crazy, and a little scary if you're a mouth breather. And I can say that as a former mouth breather when I used to sleep. I didn't know until I was like 12 years old at a sleepover that you're supposed to breathe through your nose when you sleep, because I heard some other girl talk about another girl who sleeps with her mouth open and was drooling, and I thought to myself, oh no, I better figure this out. So turns out I learned when I was 12 you're supposed to breathe through your nose. Not everybody knows. But I did try a little bit of taping. If you just put a little tape, and I didn't tape my whole mouth because that was a little scary to me, but I put a little tape over the front. Gauze tape works great. And after like a good week, I breathe through my nose now when I sleep, and I sleep much, much better. Now, there also, as I alluded to earlier, if you cannot close your mouth comfortably, that can be an issue. And that can be because your lips are actually tight, like the muscles are tight and your tissue's tight. You can have some tongue issues where your tongue doesn't have good mobility. You can also just have general lip mobility issues or jaw mobility issues. And a myofunctional therapist, which is like a physical therapist of the mouth, can help with that. Now, lastly, there's one more thing that I'm a little more attuned to, and that's helping with your posture. And your posture actually can help you get more airflow through your nose. And sometimes your airflow is impacting your posture, which is why I talked about all those other disciplines that can help you with your airflow. But a lot of times, if you just do a few simple things, you can actually open that up as well. So I'm here to tell you a little bit about that. So I'm sitting in a lower chair here today, and I'm sitting here lower because if you're sitting low, it's kind of nice to have the knees at the same height as your hips, and that helps you sit back on your sits bones. And then what we're going to do is we're going to try to turn off some of these anterior neck muscles. So those are the front neck muscles. They will tend to overwork when you're not breathing well. And they will be overworking to try to pull air into your chest if you aren't using your diaphragm and your abdomen well for breathing, which we're going to talk about in another video. So to get ready, you just need to be able to put your hands on your sternum, sit on your sits bones, and relax your shoulders. And then take a breath of air in through your nose, if you can. And then exhale all the way out and let your hands gently pull down your sternum. Then relax and hold your air out for a little bit until you get hungry for air. And then take a breath of air in. And you're basically just lengthening the front of your neck and opening up your décolletage. Then we're going to add another thing on the next breath. So on your next exhale, you can roll your head back. So exhale, sternum goes down as your head tilts up, and now we're getting even more of a lengthening and stretch through the front of your neck. And then when you're ready for your inhale, bring your nose back center and breathe in. Now I can add on to that, but before I do, just take note, when you tilt your head back, it's not actually tensing the back of these neck muscles, which is great because a lot of people get tension back there. As you roll your head back, it's actually allowing these muscles to go on slack. So it's also really beneficial for tension back here. So win-win. Now we're going to add one more layer on top of that if you want to add just a little more stretch and a little more benefit. So you take a breath of air in, exhale out, and you roll your head back. And then you can take your bottom teeth and bring them in front of your top teeth like you're doing an underbite. And that will also lengthen the neck even more. When you are ready for your inhale, bring your neck back to center and breathe in. And there you have it. So easy little posture exercise to lengthen the neck. It also brings your cranium back a little bit more in line with your shoulders after you're done with it. So as a therapist, I'm happier with that because you're going to have better looking posture. and it's going to help open up your nasopharynx so that you can inhale through your nose a little bit better. Thanks everybody for watching, and I want to do an extra special thanks to Oxygen Plus. I hope you learned something, and if you'd like to find me, you can find me at sarahpetrich.com, sarahpetrich.com, or if you want to learn more about Oxygen Plus, you can find them at oxygenplus.com.